and welcome to the AFib Exchange Call. My name is Michelle, and I'll be your moderator for today. Feel free to ask questions throughout this presentation by typing them into the Q&A box on the right-hand side, or by unmuting your line, pressing *6. Within 1 to 2 weeks, the slides and the recording to this webinar will be provided. I would now like to turn the presentation over to our Senior Director, Deb Moats. Deb, the floor is yours.
Thank you, Michelle, and welcome, everybody. Happy May Day, the 1st of May, and happy Stroke Month. So today for the Quality Exchange AFib, I would like to start out by just giving a shout-out to some ladies that are very helpful in getting this all set up, and that would be Michelle, our co-moderator, Audrey, and Larissa. Without these talented ladies, we would not be able to do all of these things. And, they help us get set up and help us get ready and then just kind of run the show, which is very useful. So I just wanted to give them a quick shout-out. So for our agenda today, we'll start with our welcome, talk a little bit about day-to-days. We'll talk about some important dates, clinical practice guidelines. There's some new ones that were just recently released, I believe in January. Some patient educational resources that might be useful for you, for professional educational resources, and then finish up with who do you contact if you need more information. All right. So we're going to start with why AFib, why get with the guidelines AFib, why do we even need that? And, it's interesting to see that patients with AFib are hospitalized twice as often as the non-AFib patients, and they're 5 times more likely to have a stroke, patients with AFib. With the prevalence of AFib on the rise, get with the guidelines AFib can really help you to be able to meet the challenge. There's quality improvement program that's designed to help the hospitals consistently apply the latest evidence-based treatment guidelines, and the goal is quality AFib care and prevention of related conditions such as stroke and heart failure. So AFib and the implications for stroke. First of all, the average person living with AFib is 5 times more likely to suffer a stroke, which I just had mentioned, and than someone with a regular heartbeat. It impacts about 3 million to 6 million people in the United States, and it's projected to increase, to double actually, by 2030. And the risk of stroke if AFib is untreated is 3 to 12% per year. And I have personal experience with that with my mother. She was not able to take the anticoagulants, and she had long-standing AFib, and knowing it was just a matter of time that she would have a stroke, and that's actually what caused her death. So a lot of personal experience with that. And then stroke from AFib has a higher severity, disability, and mortality. So therapies can prevent stroke in AFib. Oops. So this is an infographic that just kind of points out some of the things that are available to you who are using Get With The Guidelines and why it's important to have. So first of all, it's one of the only patient management tools. There may be 1 or 2 others, but it's powered by quintiles, and it uses the evidence-based information. There's point-of-care educational materials available for your patients. There's integrated decision support, and then there's follow-up forms as well, and an ablation tab. Number 2, another reason is our field staff, which is our directors of quality and systems improvement, are all available for one-on-one interactions and to support you in any way, questions that you may have. And if you're looking for maybe process improvement ideas or thoughts, then feel free to reach out to your director of quality and systems improvement, and they will be happy to help you. There's also the recognition benefit, so the Bronze, Silver, Gold Awards, and those who achieve silver or gold are published, so there is recognition within the U.S. News and World Report, which is usually published in the end of July, first part of August. And it's cost effective. It's not a very expensive program to put into place, although the cost of abstraction is probably the highest cost. And then the education. There's free education, there's webinar access, local workshops, and patient education material or resources. So a lot of things that are a part of the Get With the Guidelines AFib. And one thing I'd like to mention before I go any further is if you have people who had access to your AFib database for Get With the Guidelines that have left, you may want to let your director know so that they can take them off so they no longer have access to that. Because until somebody tells us that the person has left, we have no way of knowing and to stop their access. So if there is anybody that you would like removed, you can take a look under My Accounts and have that person removed if they are no longer a part of your organization. There is a stroke landing page that is now available. I think if you just type in 2019 Stroke Awareness Month, American Heart Association, it'll come up. But there is a direct link here for you as well. And so the start of stroke and the correlation with AFib is pretty strong, so that's why I'm sharing this information. And along with that, our National Center is presently working on a campaign for atrial fib to provide more resources for you, maybe some advertisements, some little ads, some icons that you can use, and some other things. And that will be that should be ready very soon. Hopefully, by the time Michelle sends out these slides, that should be available, and I will include that in the email so that you will have that information and you can check out the campaign materials and see if there's anything that's of interest to you. And again, I just want to remind you, anybody have any questions, comments, *6 to mute and unmute, or you can type it in the question and answer. If you'd rather not talk, you can just type in your questions there, and we'll do our best to answer those. So data days. What is data days? You hear us talking about data days, and we do these quarterly. And actually, the purpose of the data days is so that we can keep you informed as far as where you are in your quality performance achievement measures, so that the hopes is that you will be able to be recognized for your great care and your use of clinical practice guidelines and the most up-to-date care. So every quarter, your director, we get a file from Quintile. And it's just a snapshot. We usually get it on the first of the month. This year it was the 1st of April, or this quarter, I mean. And so the information that's presented to you or sent to you is actually a snapshot of what was in the TMT as of April 1. And as you know, things change every day as you go, when you go forward to adding more patients, then your data changes. So this is a snapshot. But the purpose is to really show you where you are. So we have the green that shows you, yes, you're meeting that measure at 85% or higher for the achievement award. And anything in red tells you that you're not quite there. The other thing that your director does for you then is to drill down into what patients actually fell out of the measure that's in red. And they send that to you on a spreadsheet, and that then allows you to go in and take a look at your Get With the Guidelines, take a look at the patient, make sure that there is nothing that you've missed as far as documentation, maybe there's an exclusion reason or whatever, but it just gives you a chance to do a second look of your information. And so we do it quarterly so that you kind of understand. Now we do send our reports that look like, not like that. I guess they look like this. I'm not sure if I have one in here. But anyway, the report should have come to you here this last week for your AFib quarter 1. So if you take a look at that, you can look into anything that fell out, and then, again, you can go from there. So when we look at over time. We look at our measures over time, and we see this is from 2013 to 2017, and I will also provide 2018 data for you. for the end of the year. But this just kind of shows you how, ACE-ARB, it seems like that's always been pretty easy to maintain, the 85%. Most people are able to achieve that. Same thing with beta blockers. It's in the 90s. And then we have the CHADS-2 VAS score, and that seems to be one of the biggest issues that we have across the United States, is getting that CHADS-VAS score documented. So if there's anything I'd really like you to share, if you have anything at all that you do to help to get you to get that score, I guess, documented so that you can extract it, then please share that information with some of your colleagues here on the call. That's really what this is all about, is trying to exchange best practices, talk about what you do to help succeed. And then we have the anticoagulation prescribed prior to discharge. And again, that's pretty high. Initial quarter was 50%, but the rest of it's been in the 90s. And it ended the year in, or then up to 98% in 2017. And then the PT-INR, that seems to be pretty well maintained, above 85% too. And the other measure that we are seeing is the statin measure that people need maybe just a little more assistance on. And so, again, if there's things that you do, best practices, what have you done to help to achieve and maintain those measures? Does anybody have anything they'd like to share about that? *6 to unmute, or type questions in the chat box. So this is our first quarter, 1 of 2019, and this is the aggregate of everybody in our Southwest affiliate, the 6 states, and how they maintain their data for quarter 1. So our ACE-ARB measure is currently at 70%. Now, I know April 1, a lot of the patients may not have been yet put into the registry. That's pretty early. May 1st is like right at the end of the quarter. So we understand that you're probably missing some of the patients in here, but this is, again, just a snapshot to let you know where you are. But across the system, we're right now sitting at about 70% for the ACE-ARB and ARNI prescribed prior to discharge. In 2018, at the year end was 87%. So we did, as an aggregate, achieve that measure across the system. Then 93% for the beta blockers at discharge. That's what it is as of quarter 1. And last year at the end of the year, we actually was at 100%. So that seems to be pretty well maintained, and not a lot of issues with that particular measure. And then we have our CHADS-2 VAS score and the risk score documented prior to discharge. So that right now is sitting at 75%, and last year end, we ended at 73%. So that is one of the measures that continue year after year to seem to be more difficult to achieve. So again, anybody have any ideas, thoughts, things that you can share that helped you to get that documentation into the chart for CHADS-VAS? *6 to unmute. Okay, you can think about it, and if you come up with something, jump in, stop me at any time. I am happy to help or to try to answer questions. The next one is the FDA-approved anticoagulation prescribed prior to discharge at 100%. Awesome. And year-end 2018 was 100% as well. The PT and INR planned follow-up was documented prior to discharge for those that are on warfarin, 94%, and the year-end last year for that one was 95%. So maintaining that does not seem to be a problem. And then the last one is the statin at discharge, and that's at 86% here, and at year-end it was at 80%. So obviously some of you have put some kind of measures into effect to help to improve that particular measure if you are having problems. So again, think about it. If you have something that you'd like to share, we're happy to hear. Okay. Keep losing my little guy here. Okay. So next we're going to go into some important dates that you just to be aware of. So first of all, May, this month, now is May 1st, so by the end of this month, all hospitals should be notified of their award status and receive the award email. Within that email, there's a press release, there's a certificate of achievement, there's some widgets in there for your hospital website if you'd like to put those on to share your recognition for your AFib care. There's print ads that are ready for your hospital logo. Just add your logo and you can send those out. And then the award icon creation of customized promotion. So there's a lot of good information in there, and please do use that information in those press kits, those press releases, because it's important that your community knows the hard work that you're doing with all of these measures to maintain great care. May 29th, quarter one data is due, so it's actually 60 days after the end of the quarter, and that's for, per the Joint Commission guidelines, I think, that it needs to be in, that your information needs to be in. But so quarter two, May 29th, quarter one data is due to be abstracted. July, I just mentioned the end of July. It's really the August edition. The U.S. News and World Report for silver and gold will be published. And we'll have copies of those too. So if you would like some copies of those hard copies, it usually takes us a little bit longer once it's published. But if you're looking for hard copies, then please ask your director, because we typically have some copies that we can give to you if that's something that you are interested in. And then, let's see, May, the other thing I want to mention is the International Stroke Conference abstraction submission opens May 22nd through August 13th. So if there's anything related to AFib and stroke prevention, you know, that you've done, or in your communities or anywhere actually, or anything that you've done as far as a process improvement, then think about submitting that information to the stroke conference. And the other one is QCOR. QCOR is another conference. It's down there May 15th and 16th of 2020. But there again, QCOR is much more geared to the heart issues. So AFib is one of the concentrations there. That session, scientific session, happens in Reston, Virginia. It's a beautiful time of the year. It's usually cherry blossom season. So if you're interested in submitting an abstract, please reach out to your directors. If you need help with those, we're happy to help. And then July quarter two, we will send out our quarter two snapshot reports to you. And then August 29th is when the data is due to be abstracted for quarter two. Any questions or comments on the important dates? And really, I encourage you to use your Get With the Guidelines information. Look at trends over time. Think about some process improvements that you've done within your hospital that's been successful, or if there's certain challenges that haven't been so successful, but you would like to share that at a conference, it would be great to just do a poster on those kind of things. New clinical practice guidelines. So I had mentioned that there was some new clinical practice guidelines that were released in January. This is more of a supplement. It's not the entire 1,000-page usual clinical practice guidelines, you know, usually at least 180. I think this one's like 29 pages with the actual measures. But in the supplement, I did include the link to that, and within that supplement, in red under each measure, it tells you exactly what has changed. So it might be something you want to take a look at just to make sure that you're following best practice. So that is available, Circulation Magazine. It was published in the Journal of American College of Cardiac and Heart Rhythms. So feel free to take a look at those and make sure that your guidelines are up to date. And along with that, I just want to mention again the app. We have the American Heart Association has the app that is Guidelines on the Go, it's called. So if you just go into your application store, your app store, whether it's iPhone or Android or whatever, then you can download that free of charge. And it does keep you up to date on any new changes that happen. When you check into it, it will show you in red if there's anything new that's been added to that particular disease state. And you can pick and choose what you really want to follow in that Get With the Guidelines on the Go, or Guidelines on the Go app. So if you're interested in that, then please look into it, download it. If you have any issues or problems with that, then reach out to your director, and we're happy to help. So this is a new article that was published in the Get With the Guidelines AFib data. It's adherence to guideline-directed stroke prevention therapy for atrial fib is achieved. So it's talking about the anticoagulant drugs, and there, again, is a link to that. So if you're interested in looking at this information, there's a link there for you to take a look. Next, I'm going to go into patient education. So our website has been newly updated, or it's different. It looks really nice, and there's some really great information in there. And one of them I found at this particular link was this. It's just a short little YouTube video, but it's really good, and it kind of goes through atrial fib and shows, it would show your patients or whatever. It's only like 2 or 3 minutes. It's not very long, but it has some really great information. So it's something that if you're working with your patient and they don't really quite understand what's going on with atrial fib, you can always pull this video up and show that to them. So I just wanted to share that. I had not seen that before, and I thought it was really cool. And then the American Heart Association Atrial Fib resources. So there's all kinds of resources. If you go to the www.heart.org and then AFib, then you can find out all kinds of things. And I encourage you to use those to your advantage with your patients or with your staff and or your family, actually. So there's lots of things you can link to, you can download, you can print, you can share them in your public, whatever you would like to do with it. There's many new resources. So take a look and explore that. You're looking at usually it's like the healthy living topic, the health topics, and AFib is one of those health topics that you can click on. And then there's the professionals website where you can go in and get some of the WebExes and videos and educational materials that you can use for your staff. And then this is all part, these are all part of that initial landing page when you go to the AFib experience link. There's a link on that one that links you to the AFib experience. And in that's a landing page. It's on the landing page, like I said, and in there's a lot of support. So if there's somebody in your community that's affected by AFib or one of your patients, they may want to go in there. They have like question and answers, kind of a support type of a system, and it's an online community for people that are living with AFib. So they ask questions and different people answer it, and there's just some good information that may be helpful, and it may be a link that you want to share with your patients. I know that not all patients have computer or computer literate, but some of this information can also be downloaded and handed to your patients if that's something that would be helpful for them. This, again, is part of that landing page. There's an atrial fibrillation library link, and in there you go to explore the library, you type in whatever it is that you're wanting, and there's some really great short videos that actually are animated and show the actions of the heart. What does it look like when your heart's in AFib, and what are some of the issues that happen with that. So there again, if you go to that website, click on Explore the Library, and there's lots of good information there that you may use at your discretion. And then towards the bottom of the page, there are printable information sheets on AFib. So it's a patient education resources, and there's partnering in your treatment plans, so you can download those and give those to your patients. understanding the medical treatment guidelines, the frequently asked questions. There's a symptom tracker that we can send home with your patient so that if they're going in and out of AFib and maybe have feeling fluttering or whatever at certain times, they can kind of monitor that and see how often that is happening, write it down, and then share that with their physician. We also have the medication tracker in English and in Spanish, and then What is Atrial Fib is just a brochure that you can use for your patients. And then there's other things on the other side, the Atrial Fib Spanish version. There's information about oral anticoagulation. There's information about heart diseases and stroke, and AFib and stroke, and risk factors. So if you're looking for information, again, there's some great things here all ready for you. All you got to do is print them and give those out to your patients. This, again, is showing the AFib support, the support group kind of thing, the AFib experience, and that has the community information for people who have recently been diagnosed, treatment information, there's risk factor information, there's resources, there's survivor stories, and then there's little news reports. So there's a lot of good information. Just go out and explore this, and hopefully it will be something that will be useful for you in your practice, in your program. And there again, this is an AFib experience resource, but what are the electrophysiological tests? And they're written in a language that, I think it's third grade level, I think. And that is at a level so that the patients can understand what they're talking about. So there's a link again there. Go in and use those resources for whatever you want. And then we have the professional education resources. So let's see. Coming up on May 29th, there's going to be a Get With the Guidelines AFib Best Practice Series, and it's going to be talking about establishing an atrial fib clinic from concept to reality. So if that's something you're interested, or if you have a clinic and you just want to know more information, or you might want to look into some things that other people are doing, then please join that WebEx. It's free of charge. The link is there. You can just go in and click on the link and register for that, and you will be good to go. Any questions, comments, feedback from anybody? Here, there are a couple other things that I was able to find. There's Enduring Education. So it's like a virtual conference that goes on. So at some point the conference may have happened, or it was a virtual conference, and it was recorded. And then you can go in on this link here, and you can listen to those, and you can receive credit. So again, this one is on virtual atrial fib, and taking a look at that, you can go in, register for free, take it on your own time, and get CEs for it if that's something that you're needing. There's another one on stroke prevention in atrial fib. That's also in our Enduring webinar. Again, this is the link. And there's a spotlight series that talk about stroke prevention in atrial fib. And there also, I didn't put in here, but there is also a cryptogenic stroke. There's a whole page on that with links and WebExes and information for the cryptogenic stroke patients, who oftentimes end up being an unknown atrial fib patient. Not always, but a fair amount of the cryptogenic patients are patients that have unknown AFib. So again, remember that resource. That's there and available, and I think there's things for patients there as well. Clinical tools. If you go to the Get With the Guidelines AFib Clinical Tools website, then down there, there's these that are all available. So there's a CHADS VAST Assessment Toolkit, and really what that shows you is how to drill down and find your patients and look into, so that you can follow them and try to figure out why that score wasn't documented. And again, that score can be documented by a nurse. It does not have to be physician and PA. And then there's a few other things, and I believe that there'll be some more added soon. I know that there was a AFib WebEx, I think in January or earlier this year, and that link should be here soon. So like it says here, there's more clinical tools coming soon. So again, keep an eye on the website. Lots of things there we try to provide for you so that you'll have those available for your patients and for yourself. This is a new infographic that was updated this year. So if the AFib can happen to anyone, it talks about the symptoms, what are some of the symptoms, and that sometimes nobody has any symptoms at all, and they may just find it during the regular checkup or after the person has a stroke, which is what we want to prevent. Then there's the people, it emphasizes that patients with AFib that are not treated with medications properly have a 5 times higher risk of stroke. And then there's also like the benefits, the medications, and lower the risk. So this is just a flyer that is available online. If you're unable to find it, we are happy to send you one. You could print those. If you have a clinic, you can put them up in your clinic. You can put them in your patient education booklets. Anything that might be helpful for you. So basically, I'm just printing or pointing out a bunch of resources that you may have. Another thing you may or may not know is that there is an auto-population feature for those people who have who use Get With a Guideline Stroke. So if somebody in your hospital is entering information into Get With a Guideline Stroke, you can automatically have them start a record with a lot of the demographics that will already be filled out for you, and it auto-populates. So for the if they have heart failure, then there are 120 data elements that can automatically fill in, which will save you a lot of abstraction time. And the same with the stroke. So what they do is that if they're in the AFib module or the stroke module, and you get down to the bottom where it says to save it, you can select save and create a new AFib record for this patient, and it will automatically create that record in your Get With the Guidelines AFib. So I'm not sure if you're aware of that or not, but that option is available. And it looks like about 50 data elements from the stroke population will actually fill in automatically for you. So I'm finishing up here on who do I contact? What if I need more information about any of these resources, or if you have questions or you need help with Get With the Guidelines, then you can contact your QSI director. And if you don't know who that person is, we have it here on the map. So the map kind of shows you, like Texas, there's several, like almost everybody on our team takes a part of Texas because it's so large. But Arkansas, we have Kristen Waller, who covers all of Arkansas. We have Alicia Webster, from Oklahoma, and she covers all of Oklahoma, and she also has some Texas territory. In northern Colorado and Wyoming, we have Emily Jones, and their email addresses are on here if you would like to contact them. In southern Colorado and New Mexico, it's Flannery O'Neill, and Flannery actually is our director who is the kind of expert for AFib that helps all the rest of our team. So Flannery can help you with your AFib questions as well. And then and then we have, like Allison's in the Houston area. We have Larissa in in College Station area, Corpus Christi. Sarah oversees the Austin, San Antonio, and Rio Grande Valley. Christy Esposito is in Dallas-Fort Worth area. And so, again, this is just a reference for you. So if you're looking for or needing some assistance from your AHA director, then feel free to reach out to any of these directors or somebody close to you. And they're available, again, for one-on-one consultation. Whatever kind of things that you need or you're having issues with, then please let them know, and they are happy to help. Oops. So that's really all I have. I'd like to open it up to see if there's any questions or discussion. Any questions in the chat box, Michelle?
Yes, Deb, actually, Centennial wanted to share that for their CHAS 2 back score, they presented the requirements in their cardiology meeting and hospitalist meeting, and they had, and this is how they were able to improve documentation.
Oh, great. That's a great idea. Thank you for sharing that. Any other questions, ideas, thoughts you'd like to share? What are you looking for in these exchanges? We do have these exchanges quarterly and really would like to cover whatever your burning questions are. So if you think of things along the way and you don't really know the answer to, then feel free to send me a quick email or to your director, and they will get it to me so that I can make sure and cover things that are useful and helpful for you. So if there are no further questions, then I will give you about 20 minutes back of your day, and I really thank you and appreciate you for joining this teleconference. Any last comments? Or WebEx, I mean. Okay. Thank you all. Have a great afternoon.